then this white cottage cheese consistency started coming out of there. So she had like a sebaceous abscess of like all her sweat. Yeah, and it was really bad. It was really bad,
So
guys.
was it like right here, or?
It was like right next to the areola on the lateral side, and you could just see it was just swollen in that area. But as much fluid and stuff came out of there, you wouldn't think that much stuff would come out of it. I was like, oh my gosh, like, oh well, I didn't. That was a limited ultrasound right there because I didn't get to do it to the post.
Most common side is the upper outer.
The upper outer. Okay, that's where it was. Take it from my doctor back there. Bad times. Okay, so that's my breast ultrasound story. That's my worst story in breast ultrasound. I commend those ladies. Up there. Okay, you don't want to have to. So also it provides real-time guidance for procedures. Again, if we have to do a breast biopsy, same thing with a thyroid, FNA, right? We're able to look at these this anatomy in real time. Or what we think is real time, right? Because we know ultrasound takes time. But we're able to look at it at the same time that we're doing it. Okay? With MRI, you're not able to be in there at the same time that they're actually doing the MRI. Okay? So the limitations of breast ultrasound is that it's operator and equipment dependent. Okay? Meaning that just like any ultrasound exam is going to be dependent on the operator, right? I'm probably going to get better images than you guys just because I have more experience. Okay? So it's just like when we all miss something. It's not because we don't know what we're doing. It's because we're not experienced in seeing that. We may have never seen that before. But once you see something one time, you'll never forget that. So definitely your equipment and the operator can limit the quality of the exam. Versus if you're doing an ultrasound on Toby versus doing it on an Epic at LBJ, then you know the images are going to look completely different, right? So you may miss something based on that. That's a limitation. Okay. Also, microcalcifications may not be easily imaged. If these microcalcifications are too small, the ultrasound system won't detect those. All right. And some masses with similar benign malignant characteristics, meaning, of course, we already know that we can't just eyeball a mass and I guess some doctors can, right? Because I've seen them do it. Sometimes they can go in there and say, oh, that's malignant. Oh, that's benign. You know, that's harmless. Okay? But some masses, they have similar consistencies between benign and a malignant tumor. Okay? So you won't always just be able to identify it just based on looking at it. Any questions over our sonographic role in breast anatomy? Okay. This is just the chart you guys have, chart 16.1. All right. So let's talk about the anatomy. And still, did y'all like the format? I'm still gonna use the same format, just like I did with the thyroid. I'm gonna continue the same kind of format, that same flow. All right. So the breast, also known as the mammary glands, are paired, dome-shaped anterior chest wall structures. When we're talking about breast in this class, of course, we're going to be talking about it more from the female perspective because they have the functional portion of breast tissue. Okay? So this lecture will be more based on the female perspective. The men, we don't have the functional portion of breast tissue. Okay? Breast tissue, they're exocrine glands, right? Not secreted into the blood vessels. Okay, are also known as modified sweat glands. Okay, the primary function of the breast is to produce milk to nourish maternal offspring. In many women, breasts extend into the axilla. When you're doing breast ultrasound, I can't tell you how many ultrasound. This is something I have done a lot of. I've done axillary exams to make sure there's no mass there. Okay, because breast tissue does extend into the axilla. This extension right here, guys, that breast extension, that's called the tail of Spence or the axillary tail of the breast. Okay, you see the little extension right there? They're like a little tail.
Axillary tail.
Axillary tail of the breast or the tail of Spence. Okay. Kind of looks like that tail of the prostate, right? When you're looking at the seminal vesicles. That is the tail of the sphinx. All right. Any questions? Yeah. Okay. That, feel free to chime in. Okay. The external surface of the breast, guys, it consists of three things: the skin, the nipple, and the areola. Okay. The outer part, the outer epidermis above the skin or right at the skin, and underlying dermis of the skin contain hair follicles, sebaceous, and sweat glands. Okay. Sebaceous meaning it's a gland that secretes like a waxy, kind of fatty substance. Okay. And sweat glands. All right. The nipple is a round fibromuscular papilla located in the center of the breast, and it's surrounded by the areola. Okay. The areola is a pigmented around the nipple, meaning it has, most of the time it's a different shade, a different color. Consists of the Montgomery glands. Those are those small bumps in the areola around the nipple, and they secrete the oily substance. Okay. So those are our sebaceous glands, also known as our Montgomery glands in the areola. Okay. You ladies like, you know this already. Okay. So what is the composition of the breast tissue? Female breast is primarily comprised of glandular, fatty, and fibrous connective tissue. Okay. It varies based on age and hormonal status. Okay. And there's two different elements of breast composition. One would be the glandular elements. Glandular elements would be to primarily produce and transport the milk. Okay. The glandular elements are the functional portion of the breast tissue. You can see right here, these little lobulations right here, those are the actual glandular elements of the breast tissue. They function to produce the breast milk. The stromal elements consist of the fat, fibrous connective tissues, blood vessels, lymphatics, and nerves. Okay. So the fat, of course, guys, you can see the fat very easily. It's the yellow portion on this image right here. We have some ligaments right here, and we don't see the vascularity yet, but I'm going to show that soon. This right here, guys, is our pectoralis major muscle behind the breast. Okay, so glandular elements produce and transport the milk. The stromal elements is everything else: fat, fibrous connective tissue, nerves, lymphatics, blood vessels. Okay, you have a cluster of lymph nodes in the axilla right here, guys, in the armpit. Okay, just like you have that cluster of lymph nodes in the neck. Okay, you also have another cluster in the groin. All right. So the breasts are divided into 3 layers. Okay, 3 layers or 3 zones. Okay, those layers consist of the subcutaneous fat layer. Okay, that's the layer that, and we're talking about from the outside to the inside. Okay, the subcutaneous fat layer identified here is number 8, guys. That's the area just beneath the skin. Okay? Subcutaneous, just beneath the skin. All right. That's also known as the pre-mammary zone. Okay? The pre-mammary layer. Okay. Number 2, we have the mammary or parenchymal layer, and that's where all that is identified as number 9. You can see number 9 right here. I don't know if you can see it's outlined a little bit, real light. But that's that's where the functional portion of the breast tissue is, in the mammary or parenchymal zone. Okay? That's where the functional portion is. Okay? And we also have the retromammary. Okay? That is going to be identified here by number 10. That is the area just posterior and anterior to the pectoralis major muscle. Okay? Identified right here as number 10. Okay? That's our retromammary zone or layer right there. So subcutaneous or pre-mammary, we have our mammary or parenchymal layer, and then we have our retromammary. Okay, retro meaning behind. Here's an ultrasound, and you can see how it appears on the actual ultrasound right here, guys. We have our first layer right here, would be our subcutaneous layer. Okay, this is our, you can see our skin line very clear right here, right? So our skin line very clear. All right. Then we have the next layer, our mammary layer. Again, our mammary, that's where all our functional breast tissue is. For all of you ladies, where your functional breast tissue is. Okay. Then we have our retromammary layer right here, the area just behind the mammary layer. Can you guys see the difference between those layers? No? Whenever I kind of look at breast, it always kind of looks like waves to me. It always just kind of looks like, as you're flowing, as you're scanning, it just kind of looks like you're in the sea or something. It looks like water, just kind of how those striations are. Okay. So, and then we have posterior to all of that, the pectoralis major muscle. Guys, know those zones are those layers and their relationship to each other. Okay. So, the mammary or parenchymal layer, which is of course the middle layer, right? The middle layer, that contains the functional glandular elements and supporting connective tissues, such as Cooper's ligaments. Okay. It has these lobes. You see the little, this little thing is a lobe right here. All right, you see the little lobes right there, guys? Lobe, 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 lobe. All the little purple things, little clusters. Okay, those are the overlapping lobes arranged in radial fashion around the nipple. Those are the actual functional portions of the breast tissue. Okay, there's 15 to 20 of those around the actual nipple itself. Okay, each lobe contains 20 to 40 terminal ductal lobular units. Right here, this whole thing right here is a terminal ductal lobular unit. So each one of these little lobules has 20 to 40 of those TDLUs, terminal ductal lobular units. Okay.
Can I see it in the ultrasound?
Huh? You can't see it that specifically. You can't like identify unless like they have something backed up. You know, like if they have like something where it's not flowing correctly and the fluid gets backed up, then you can see those lobulations. You know, but unless there's something wrong, you can't see the individual TDLUs or functional units. Okay. So those TDLUs, terminal ductal lobular units, they're the functional unit of the breast. Okay, this is where the breast milk is going to be produced and transported from. All right, it's composed of a lobule and it's draining extra lobular terminal duct. So, right here, guys, we have our lobules right here. See our lobules? Boom, boom, boom. And this is our extra lobular terminal duct right here, where the milk is going to transport. Okay? So the milk is formed in this area right here, in the terminal ductiles. The terminal meaning those are the end, right? So it's going to form on these branches of the terminal ductiles, the milk, and it's going to transport out of these TDLUs through the extralobular terminal duct. Okay. And I'll just pick it up right here next time, guys, because it is exactly 10:11. It's 10:11. So physics starts at 10:20. No? Yes. You get 10 minutes break. You get 10, right?
10:10.
Physics actually,